This is Module 3, Chapter 11, Working in the Community. Please review this section and complete the assignment with a minimum score of 80%.
When discussing the role of demographics in the community relations, we need to look at a variety of factors. Every community is different, and demographics will vary based on several factors, such as our geography and population. Every EMS agency should take an active role in promoting EMS safety education in their community to help in risk reduction. This can cover a variety of programs such as traffic safety, pediatric and geriatric safety, and promote safety for youthful drivers. As part of this program, we are going to review opportunities that agencies can explore to improve EMS-related public education within the community. As with all aspects of EMS within the community, we'll start at the local level. Volunteer rescue agencies are often established by community members after a local disaster or tragic event. Remember that the first volunteer rescue squad in the nation was established in Roanoke, Virginia, following the tragic drowning of a local resident. Since the 1940s, many volunteer rescue squads have had their quarters available for public meetings and assemblies. Many will build their stations to include a large meeting hall, which can be used for fundraising events such as bingo, fish fries, wedding receptions, and other community events. This helps community members to understand the importance and the role of their local EMS agency. EMS agencies and their personnel, whether volunteer or career, continue to be viewed as an important member of the community. Every EMS officer, regardless of rank, plays an important role as a representative of the agency. Members of the community will look to you as the officer for leadership, guidance, and advice. Not only is a working knowledge of the community important for EMS response to emergency incidents, an EMS officer needs to understand the population and demographics. This is invaluable when you're trying to determine the appropriate services and information on safety programs for the community. Population and demographic data for your locality and state is available through a variety of resources, including the U.S. Census Bureau, the U.S. Department of Labor, and the U.S. Department of Health and Human Services. Demographics are used in marketing and business to define a target audience for a product or service. And EMS demographics will help to determine specific groups within the service are in order to properly serve their needs. For example, it would be important to identify neighborhoods with small children to address the needs of pediatric population. Some examples may include pool safety, helmet use, and car seat installations. Likewise, it would be important to identify neighborhoods with an elderly population to address their needs. Examples may include fall prevention and hands-only CPR. The United States of America has been a melting pot of various nationalities and cultural diversity since the founding at Jamestown in 1607. Emergencies do not limit themselves to a particular ethnicity or culture. Therefore, all EMS personnel must meet the needs of the entire community. It may become necessary for the EMS officer to balance the needs for immediate actions to save lives with the potential for violating cultural customs. Involving members of the various cultural groups within the community may help to ensure you are respectful of cultural traits, values, and characteristics. Since its inception, all EMS agencies have followed the tradition of striving to reduce the risk due to injury or illness. This concept became more widespread after the publication of the EMS Agenda for the Future in 1996. The agenda said EMS systems and providers should be continuously engaged in injury and illness prevention programs. The evolving role of EMS as a partner in the overall healthcare system nationally will likely drive an even greater role for EMS in community risk reduction. There are two levels of need to reduce risk in the community. Systemic, dealing with the community risk, such as child safety programs, bike helmet, pool, and Halloween safety. Individual, dealing with individual citizen or family risks such as child abuse and lack of heat. There are two levels of need to reduce risk in the community: systemic and individual. Systemic needs can be addressed through the development of programs to eliminate or reduce risk, such as bicycle helmet safety programs and fall prevention programs. These programs are community-wide and often involve many organizations and agencies. As an EMS officer, you may come across a systemic need that should be addressed. You must report these needs to your supervising officer. The second level of need is at the individual level. This would occur while responding to a patient's home. An EMS officer should always have a good understanding of what the community programs are available. For example, heating assistance programs for those on a fixed income or fall prevention resources for an elderly couple. Your role as an EMS officer is to connect the citizen in need with the community resource. Some examples of various community programs that may be beneficial to the citizens in the community include Safe Kid programs, CERT programs, child car seat installation programs, programs offered by community social services, mental health and substance abuse counseling services. As an EMS officer, you should be prepared to refer a patient or a family member to these resources. Public inquiries can range from questions about services provided by EMS to complaints about an agency policy or an individual's performance. An EMS officer needs to treat all requests in a professional manner. Always gather all information immediately and be sure the information is accurate. If the request is not within your level of authority, you need to submit to the next higher level of responsibility to be resolved. Every agency has different processes, policies, or guidelines to follow when handling a citizen inquiry or complaint. Some agencies may allow the EMS officer to answer citizen inquiries directly, while others may require all inquiries to be forwarded to administration. It is important to understand and follow these policies to avoid the appearance of unfairness. These programs will vary by agency based on their size and complexity. Some agencies have a large staff to handle public education programs, while other departments may assign it on-duty crews. Some agencies adopt national programs, while others may develop a local program to meet the specific needs of their own community. Every EMS officer should understand some of the basic principles of public education programs. Other examples include EMS safety for babysitters, EMS safety for seniors, and bicycle safety helmet programs. The fundamental goal of public EMS education programs is to prevent injury, death, or loss due to injury or illness. EMS officers may be invited to provide a presentation about EMS to civic organizations. These programs are meant to prevent injury, illness, or death due to emergency incidents, or they might be able to provide an overview of how EMS is delivered in the locality and how the public may help. Some presentations are a simple marketing of your service. That is a different form of public education. The following slides list the components of public education. Four objectives of an EMS safety program are to educate patients and citizens on how to change their behavior, provide instruction to patients and citizens on how to perform specific tasks, inform patients and citizens on important EMS safety issues, and to distribute information on timely EMS issues, such as safe driving, no texting and driving, wearing your seatbelts, proper installation of child safety seats, and so forth. A public education presentation is successful when it causes a change of behavior. You should have a specific goal in mind when educating citizens and patients. Many national and regional public education programs have been developed by professional associations and include EMS for Children, Child Safety Seat Education, Cardiovascular Disease Prevention, recognizing the signs and symptoms and rapidly calling 911, the Vial of Life, Medic Alert, Rider Alert Program, the Safe Haven Program, Also, your local EMS council may have public relations handouts and presentations already packaged. RiskWatch was developed by the National Fire Protection Agency, also known as the NFPA, and is a school-based program aimed at the elementary students. It provides children and their families the skills and knowledge needed to create safer homes and communities. The curriculum is divided into several lessons. Citizens Emergency Response Training, abbreviated CERT, is part of a National Citizens Corps initiative. The CERT program helps provide citizens an understanding of how they can help or assist in many disaster type situations. Groups of CERT-trained citizens can provide assistance to victims and collect and provide disaster intelligence information to the proper authorities. Consult with your local emergency manager for information about your local CERT program. CERT was originally developed by the Los Angeles Fire Department, and the program was adopted and materials expanded by the Emergency Management Institute and the National Fire Academy. The CERT program was moved under the Citizen Corps in 2004. CERT instructors are required to complete a CERT training, including Train the Trainer program, before they can provide instruction. CERT training topics include safety and utility control, disaster medical operations, light search and rescue operations, disaster psychology, and terrorism in CERT. Safe Kids Worldwide is a global organization dedicated to preventing injuries in children, the #1 killer of kids in the United States. When a child dies or seriously injured, the lives of many families, the entire community, is changed forever. But these tragedies don't have to happen. Some regional and locally developed programs include Camp Rescue and EMS Camp for Kids. These programs allow children to participate in and practice EMS procedures in a safe and fun environment. Bicycle and motorcycle rider safety and helmet programs that encourage children and adults to wear a helmet when riding a bicycle or motorcycle. Local programs may be developed by EMS agencies to prevent an unsafe act that has been identified in a local area. For example, Richmond Ambulance Authority developed a crossing alert program to address the increased amount of motor vehicle collisions involving pedestrians being struck. Many agencies have started a hands-only CPR campaign to reduce the amount of deaths from sudden cardiac arrest. This program aims to teach the general public how to perform compressions only until first responders arrive. Every community is different and will have special needs that will affect how the EMS agency will be required to provide services. EMS agencies have direct contact with many members of the community. As an EMS officer, you and your team represent your EMS agency. An important method of preventing injuries, illness, or death is to change the behavior through public education programs. The EMS officer has an important role in answering public inquiries or directing inquiries to the best source for an effective response. The best method of preventing injuries, illness, or death in an emergency is by preventing the emergency from occurring in the first place. The EMS officer has an important role in providing community education programs, which can help change behaviors. There are many examples of regional, state, and national public education programs, and information is already available to use. Or through an effective planning process, the EMS officer can develop and present a locally developed program.